to look at the care process for nutrition and dietetic practice. This is based on the British Dietetic Association's Model and Process for Dietetic Practice 2012. This is a 7-component model starting with the identification of the nutritional need via assessment, identification, planning and implementation with monitoring and review of the whole process. An important addition is evaluation of how the practice is fitting with service needs. An important point to remember is that communication is vital at all stages to build a constructive therapeutic relationship with the patients and their carers. We'll start by looking at what is meant by identification of nutritional need. Identifying the nutritional need is a vital part of nutritional assessment. This can have a number of key techniques, such as history taking, looking at the nutritional intake of the patient or the group, anthropometry, physical examination and biochemical tests. The nutritional assessment is able to quantify the impairment of nutritional status in terms of either an excess of intake of a particular nutrient or energy towards requirements or a deficit related to that. The first steps will involve looking at a number of tools, which could be a referral letter, patient notes, or information systems available in the care setting. To assess a patient's nutritional status, there are key areas. It is not vital to link these to the letters presented here. For example, some people would include under D also drug and demographic data, but this is a useful way of reminding yourself of the steps to go through. Remember, it is not vital to include all these steps in every consultation, but considering these areas is important when making a holistic and rounded nutritional assessment of an individual. Once this is done, it's possible to identify the nutritional diagnosis. It's important to note this is not necessarily the same as a medical diagnosis and can be thought to have 3 components. The problem, whether there's an alteration in the patient's nutritional status, as in there's too much or too little of a particular nutrient, nutrients or energy. The etiology, the relationship of the disease, the situation the patient or group may well be in, and this will link back to your knowledge of biochemistry, pathology, physiology, as well as your psychosocial knowledge of dietetics. Then it's looking at the signs. So these will be the clues given to you by your assessment process, which will give you evidence of the existence of a nutritional program. This will allow you to then move on to plan the nutrition and dietetic intervention. This is linking to what outcomes you're expecting to achieve from this plan. Much more practice in healthcare in general, as well as dietetics, is linked to actual patient outcomes. So consider what you're trying to achieve. Can this, for example, improve knowledge of the patient or the carers, lead to a change in food or lifestyle behaviour, a pattern of intake which may improve health, which then may improve nutritional status, which ultimately will result in a health or clinical outcome. It is also important to remember care in modern healthcare services is also focused on patient-centred outcomes, reported outcomes from the patients or perceived outcomes from the patients, as well as economic outcomes in terms of productivity to the wider society. Once we have a plan, it is important then to move on to implementing the plan. A plan is of little use unless it is actually put into action. The nutritional care plan may be put into place by the dietitians themselves, but it's more likely to be carried out by others. This could be healthcare professionals and other carers in a ward situation, or the patients themselves as part of self-care. So key aspects here to remember: communication in negotiating the change with the patient, carers or healthcare professionals, so it doesn't follow the dietitian's agenda only. You need to be careful about goal setting so they're achievable, measurable, time-specific and specific goals under SMART principles. You have to look at the acceptability and understanding of the actual person you're trying to communicate that plan to. And then you need to determine the need to follow up and review this and who will be doing this. For example, this may be a practice nurse in a primary care setting if you're working with an overweight client. After you've put into place a plan, it's important to consider monitoring and review. How do you know that plan has worked? This is to look if the aims have been achieved or partly achieved by the patient. And if they've not been, is that because they're not acceptable to the patient or the person you're working with? And you may need to then change or moderate the plan accordingly. If it's part of a staged educational process, you may wish to add further goals to build on the initial intervention. By measuring outcomes in this way, you can justify the need for dietetic services and the funding included with that. And also it's important for quality of services, very important in the current healthcare environment, that we look at the patient's reported and perceived outcomes. This is often an area that's missed and overlooked by students when providing coursework and initially on placement. When you look wider from the actual monitoring of individuals, you can look at evaluation of service. And this could be by feedback from patients or carers through surveys. Case reviews. This is an important part of some of the case studies we provide you at university, but also when you're on practice in placements. And ultimately things like audits and service evaluations. This is in its simplest form looking at whether your intervention worked. And that's using the same approach again, whether it needs changing. This is an important part of evidence-based practice. You look at what the evidence suggests should be the way of intervening in a certain situation with diet, then you look to see if it needs modifying or improving next time to suit the groups you're working with. Hopefully this overview of the dietetic care process will be useful as part of your studies. You may wish to use this model to help design case studies and model answers for your revision later on. Thank you.